Hello guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Chapter 69. Today we're gonna talk about the malignant lymphoma findings, chest X-ray and CAT scan findings of malignant lymphoma of the thorax. Let's go. This is the chest lateral film, as you know, defining the area of mediastinum. Please focus on the yellow circle area. Superior mediastinum, anterior mediastinum, middle mediastinum, not usually posterior mediastinum. There they hide themselves. Thoracic malignant lymphoma. Please focus on the CT, the white circle area. ITMIG defined the compartment of mediastinum as prevascular, visceral, and paravertebral compartment. Among them, prevascular and visceral compartments are there they hide themselves in the axial CT. Thoracic malignant lymphoma. Malignant lymphoma is defined as the group of blood and lymph node tumors that develop from lymphocytes. Signs and symptoms are enlarged, usually painless lymph nodes, fever, drenching night sweats, weight loss, itching, fatigue, and chest pain. There are many subtypes in malignant lymphoma, and two main categories are there. 90% of malignant lymphomas are composed of non-Hodgkin's lymphoma, and only 10% is Hodgkin's disease. Hodgkin's disease usually involves the thorax, almost 85%, and non-Hodgkin's lymphoma involves thorax, about 45%. Lymphoma and leukemia and myeloma are a part of a broad group of hematopoietic and lymphoid tissues. Diagnosis: lymph node biopsy. Pathologic biopsy of lymph node is the main method of diagnosis. Blood, urine, bone marrow testing may be helpful, and medical imaging such as chest X-ray, CT, PET-CT are usually important methods for diagnosis, staging, and follow-up. Usually, lymphoma spreads to lung, liver, and brain. Staging and other staging. Single lymph node group is stage 1, and more than 2 lymph node groups are stage 2. And lymph nodes involving above and below the diaphragm are staged as 3, and the stage 4 is extranodal involvement. In year 2019 in Korea, there has been a nationwide survey about the lymphoma subtypes. 95% were non-Hodgkin's lymphoma. Hodgkin's lymphoma, 5%. Among non-Hodgkin's lymphoma, B-cell lymphoma was 83% and T-cell, NK cell lymphoma was 16%. Among non-Hodgkin's lymphoma subtypes, diffuse large B-cell lymphoma occupied 42%, myeloma 20%. Nodular sclerosis type was 50% of Hodgkin's disease. Mediastinal thoracic lymphomas are common. They are part of disseminated disease or, less commonly, as primary disease. Among primary mediastinal masses, 15% are lymphoma. Among children, anterior mediastinal masses, 45% are lymphoma. They usually arise from thymus or lymph nodes. The most important slide is this: X-ray or CAT scan findings of thoracic malignant lymphoma. First, chest PA. It's soft tissue mass, mediastinal widening, or retrosternal opacity. It means large mediastinal mass, and CAT-scan, soft tissue density mass with smooth or lobulated margin, conforms to surrounding structure. It used to be called as sandwich sign, and sometimes with cystic low densities, sometimes with parenchymal and chest wall invasion, sometimes with pleural pericardial effusion. These findings are not so much specific according to subtypes of malignant lymphoma, so we just suggest as lymphoma, not as specific subtypes. That's why we do need differential diagnosis about malignant lymphoma and mediastinal tumor mass. First, thymic tumor. Second, lymph node metastasis from lung cancer. Third, germ cell tumor. Fourth, tuberculous lymphadenopathy. You fellas quit smoking? Bravo! Smoking is also a bad guy for lymphoma occurrence. Now it's time to enjoy the findings of malignant lymphoma of the thorax. This is the normal gold standard image of chest X-ray. Let's compare what's the difference between this image and the malignant lymphoma patient's images. Case number 1. What's the difference between the normal chest X-ray and this patient's images? Mediastinal widening, bulky widening. On the right side, disruption of the right paratracheal stripe and bulging contour, and left, disruption, disappearance of AP window line with bulging mass. And we also see the bilateral pleural effusion. On left lateral film, we see the retrosternal obscuration and pleural effusion below. Axial contrast CT shows us bilateral mediastinal and bilateral axillary lymph node enlargement with bilateral pleural effusion. On right side, PET-CT MIP image shows where normally the lymph node chains are distributed from bilateral neck, bilateral axilla, bilateral mediastinum, abdominal, paravertebral, pelvic, inguinal lymph node chains are all showing us heart uptakes. This is diffuse large B-cell lymphoma. 30-year-old man. Frontal radiograph shows us bilateral mediastinal widening, bilateral hilar fullis. On the lateral film, retrosternal hazing, increased obscuration, indicating large, bulky anterior mediastinal mass. The white arrows on the axial CT show us that large, bulky anterior mediastinal mass is conforming to surrounding tissues such as ascending and descending aorta and superior vena cava. That is sandwich sign. This is another diffuse large B-cell lymphoma. 70-year-old woman's frontal radiograph shows us right mediastinal mass, hilar mass, and right middle of nodule. Her left side mediastinum is looking relatively good. On your right side, coronal contrast enhanced CT, we see right supraclavicular lymph node, right mediastinal lymph node enlargement. After chemotherapy, her mediastinal and hilar lymph node masses has markedly decreased in size. This is anaplastic large B-cell lymphoma. On the frontal radiograph, we see left hilar bulky mass. On the lateral film, we don't see retrosternal obscuration, but we see hilar fullis. This is left hilar mass. Contrast-enhanced axial CT shows us subcarinal lymph node, left interlobar lymph node, lower paratracheal bilateral lymph node enlargement, and AP window lymph node enlargement. Mantle cell lymphoma. 30-year-old woman. Another bilateral mediastinal and hilar bulky mass. On the lateral film, we see the retrosternal obscuration. Axial CT scan shows us prevascular, right lower paratracheal, right hilar, and AP window lymph node enlargement. Conglomerated lymph node mass. It was proved as Hodgkin's disease of nodular sclerosis type. This case number 6 is somewhat different, but looking almost same as other malignant lymphomas. Frontal radiograph shows right paramediastinal and hilar mass with right pleural effusion. And on contrast-enhanced CT, we see conglomerated lymph node mass also showing us sandwich sign. The mass conforms to the surrounding vascular structures, almost mimicking malignant lymphoma. This is non-small cell lung cancer of lymph node metastasis. It is important to understand that not only lymphoma but also lymph node metastasis can show us sandwich sign. Now we are almost there. This is the last case of our tour. But this frontal radiograph shows us something different between the previous 6 cases. Not mediastinal widening, not mediastinal mass, not hilar mass, but right upper lobe consolidation and air bronchogram, something like alveolar lobar pneumonia. What's this? Look at these axial images. No remarkable contrast enhancement on the CT. No remarkable heart uptake on the PET-CT. This tumor is usually low grade. We call them maltoma, sometimes baltoma. They usually look like alveolar pneumonia. Subscribed and good. Thank you very much. Merci beaucoup. Thank you for watching. Have a good time. Bye-bye.